So we're talking about disorders of amino acid metabolism. So this one is kind of like an introduction to the types of disorders you have when amino acid is not metabolized the right way. You understand? So we are not actually be talking in depth on things. No. We'll just be picking them briefly like that. Okay. Disorders of aromatic acid metabolism sorry. So this is it. Alright. We have a pathway here where phenylalanine is supposed to be converted right to fumarate and acetoacetate. So you have enzymes that are looking after or mediating this pathway. So if there's lack or shortage of any of these enzymes, you now have a build back of the products. You understand? So disorders of aromatic acid metabolism just involves abnormalities in the breakdown and utilization of aromatic acids like phenylalanine, tyrosine, or tryptophan. Okay. So these disorders are often genetic metabolic conditions. So it's genetically linked. For you to just wake up and you don't have an enzyme that everybody has is due to a defect in your genes, right? So it will lead to various clinical manifestations. Now for this lecture, we're just looking at everything on a high note. Okay, on a high note. We will now pick Phenylketonuria, look at it. Alkaptonuria, look at it. Tyrosinemia, look at it. Hartnup Disease, look at it. So Phenylketonuria, which is the first one, there's defect, deficiency, or absence of this phenylalanine hydroxylase. Now that's the enzyme that is needed for phenylalanine to be converted to my picture is blocking it, to tyrosine. So that means there will be a lot of phenylalanine built back in the body because you don't have the enzyme that is supposed to break it down. So there's deficiency in phenylalanine hydroxylase, leading to accumulation of phenylalanine, which can cause neurological damages if left untreated. The Alkaptonuria, that one results in there's defect in homogeneous dioxygenase. Okay, so I didn't bring the pathway here, but okay, can you see that there's deposits of those amino acids? Okay, so they said that there's accumulation of homogeneous acid. So there's deposition of homogeneous acid in tissues. That's what they call ochronosis. Right. So I've Alkaptonuria in particular, I've already spoken about Alkaptonuria. So Tyrosinemia, that one is defect in tyrosine metabolism leading to dysfunctions. Now in Tyrosinemia, there could be defects in different. You see from this tyrosine now, there could be defects in tyrosine amino transferase. There could be defects in p-hydroxy phenylpyruvic acid dehydrogenase. There could be defects in homogeneous dioxygenase. So they are now reclassified into the type 1, type 2, type 3. We'll look at tyrosine in depth, don't worry. Hartnup disease is a disorder that affects the tryptophan absorption, leading to pellagra-like symptoms. Okay, due to deficiency of niacin. So on the general, their clinical manifestation, they usually manifest with neurological symptoms, skin changes where there's hyperpigmentation on the skin, dermatitis. You can see that. Alright, liver function, musculoskeletal system abnormalities. Their treatment diagnosis is basically these things. When they accumulate in the body, they are found in urine. So you do tests to actually dictate their levels in urine. Dietary modification. So if you know that you are lacking in an enzyme, you reduce the way you take foods that contain products that need to be acted upon by the enzyme. You understand? Enzyme replacement therapy. You are basically replacing the enzymes that are lacking. Then supplementation can be done. Okay. So this is tyrosinemia. So we spoke a lot without even looking at the picture. This is Hartnup disease. Okay. So here is a list: Phenylketonuria, Tyrosinemia, Alkaptonuria. There's also one known as Guthrie's cretinism. We'll look at it. Also albinism, what we see in our society every day. Okay, so that's it.